who have received some formal training in writing a death certificate. Training, just raise your hands. We are so confident that we will get some training either in extension or graduation, during internship, or some teacher to start you how to write a death certificate. Or it looks like write a death certificate, you write a bill and it's kind of trust. So nobody has got a common training. And this is, I think this is true. Like, I would like to share my experience. Like, I was also sure of how to write a correct death certificate almost a decade back. And then there was a court case regarding some patient. And as a faculty, we had to go to the court and present our case. And the death certificate was presented in front of the judge. And what was written in the certificate was cardiac arrest. That's all. And a few some diagnoses, and ultimately it is cardiac arrest. So nothing was clear. Nothing was clear. So we were asked, like, this is not the way. Like, can you elaborate on how the patient died? It was a medical legal case. How the patient died. So then we realized that it's an extremely important subject. The students need to be taught, and we should fill it correctly because it's a very important legal document. Now, if you look into history, just a little bit about history. The first autopsy was done on the body of Julius Caesar, and it was a physician Antistius in 44 BC. And we just look at his finding. He says Caesar had 23 stab wounds, but only one was total. So what is the communication? The communication was that all wounds were not total, and he succumbed to one injury. So they were also trying to be precise that what was the cause of death, not abstract. It could be because of substance, it could be individual, it could be chemical, it could be this, it could be that. No, very precise. So you need to be very precise when you're writing a death certificate. Now, as far as the registration started, it started first in England. And it was really far. There was also like the father who was given this system of birth and death registration, and he gave the international classification of diseases. And ultimately, it came to India in 1969 when we had our first act of registration of births and deaths. And then, since then, it is mandatory that you should have the details of the birth and you should have the details of the death. So the terminology, then a few cases will be discussed and some practical tips for you that how you should write a correct death certificate. Now just, can anybody volunteer to fill this death certificate? A 70-year-old man, known case of diabetes, hypertension, COPD, admitted to the emergency with fever, shortness of breath, cough with expectoration, and is hypertensive. He shifted to intensive care unit, gets intubated, vasopressors are started, he develops shock, ring replacement therapy is given for AKM, and he suffers a cardiac arrest. So how to fill this death certificate? Any volunteers? Or I'll move ahead and then retrospectively see how you fill it. Any volunteers? How many of you have filled death certificates? Just raise your hands. Not many people. So, any takers for this? Difficult. Immediate cause. As immediate one failure. Okay. And then antecedent. Okay. Septicemia. Hmm. So C is the underlying cause. Now we'll discuss, we'll see. So you just keep in mind that how you fill this birth certificate and we'll see how it is to be really filled. Now, why birth certificates are important? It's a very important document. It's a legal document, as I told you. It's conducting epidemiological studies. What is the cause of death in a particular area, in a particular continent, in a particular country, in a particular setting? What is the common cause in issue? What is the in any issue? So this data comes from birth certificates, and it helps in research. Now, this is just an example for you. The statistics as given by WHO. The causes of death. They have changed now, but this is another data. Just to give you an example. So, this data. It comes from death certificates. So now you see what happens to this. When correctly, you are giving the to the national societies and you are giving to the international societies. And we need to know that what is the root cause of death in a particular country or a particular area, in a particular region. It is also important for the family. A lot of reasons are there. I will not go into the details, but yes, it is important. At the national level, you know, a lot of like welfare departments, health and family welfare, when research societies, research bodies, but the statistics and some problems that how to improve the statistics of a particular area, how to decrease the birth rate. So when you do plan resource allocation, proper resource utilization, so we have to focus on that area. And this is the leading cause of in that particular area. So that will information will come from properly birth certificate. So that is not a mission. We don't know where to allocate our resources. Now, writing a birth certificate is a process. It has been described as a process. So once you pronounce that the patient is dead, then there has to be a certifying physician. Then there is a manner of death, natural or unnatural. So whether unnatural causes of death. Okay, what else? Suicide, homicide, accidental, or unidentified. And then there has to be in some cases, it becomes your duty to even need notification. You have to meet the parent, you have to meet the police if it's a medical legal case. So before you have to take certain points in consideration, and then you have to write it. Now, the form which you use the SGPGI, which is used it's just the reason that the discrepancies should be as least as possible. So statistics, perfectly. The leading causes of death, the leading causes of why people are dying because of a particular disease. So this is what the WHO wants, and that is why this certificate, the format is uniform. There are some changes in the headings and in the certificate that is fixed. It has got two parts. So the part one has got three components: immediate cause of death, intermediate cause of death, and then the underlying cause of death. These are the three main components of part one, and this is a part two. Significant conditions which may have contributed to death. So if you feel the patient had some comorbidities, if you feel that unless then diabetes not contributing to death, then you can write diabetes. But if you have diabetes, hypertension, COPD, asthma, hyperthyroidism, everything, whatever you add, see, it makes no sense because we are not able to understand what is the reason which hospital admission. So you need to go through the details. It has to be very precise. So some communities, like certified physician, almost certifies the cause of death. So what do you mean the underlying cause of death? The disease that triggers the chain of events leading to the patient's death. And without which the death would not have occurred. So the trigger becomes the underlying cause of death. It should be ecologically as specific as possible. Now you look at the example. This is the underlying cause of death. Arteriosclerotic coronary artery disease. And when you look at the sequence of events, another intelligent way of interpreting your death certificate, but whether I have filled them correctly or not, is that there should be some sequence as you move from underlying to antecedent to immediate. So sequence. If you see that the antecedent, if the is contributed to antecedent and antecedent has contributed to immediate cause of death, most of the times you will be correct. Most of the times you will be correct. So this is underlying cause of death, the trigger. Now comes antecedent. Disease or condition that occurred as a result of the so antecedents. So I'm not talking about diabetes, I'm not talking about hypertension, COPD, nothing. The patient came with community acquired pneumonia. You may have a lot of comorbidities, but they have nothing to do with this death certificate. So a disease or condition that occurred as a result of still is not the immediate cause of death. But still it is not the immediate cause of death. This is antecedent. Now this is what it is. So antecedent is arteriosclerotic coronary artery disease, and it leads to the coronary artery. So this becomes your antecedent. Now, antecedents, you can have one, you can have two, and you can have three. If the lines are not, you can even write some more lines in it. You have been given the necessity to write at least 3 antecedent causes. You can write it. Now, this is also antecedent. So, atherosclerotic coronary artery disease leading to thrombus, leading to acute myocardial infarct. So, underlying followed by antecedents. And then the immediate cause of death. The final complication resulting from the cause of death just to the time of death. Just to the time of death. So, there is another which is very important. What is that? The time. So, the sequence which occurs just to the time of death. That becomes your immediate cause of death. So now what is the immediate cause of death? Rupture of the septal myocardium. Now you see how specific they are. You could write acute MI and then cardiac arrest. That can also be a cardiac arrest. That can also be a death certificate. But now you see the amount of information you're getting from this. So if you have to look at the statistics, how many patients of atherosclerotic coronary artery disease are dying because of that? This death certificate will add to it. So you can get yes, out of 110 are dying because of this. And this is how you get the world statistics about the death causes of death. Now, mechanisms of death, like cardiac arrest, respiratory arrest. physiological mechanisms. You can never find his immediate cause of death. So if you know, when you feel the certificate process, where does it go? It goes to the hospital record section, our record section, and they have got a census department. Now, what do we do then? They upload this death certificate to the register office, which is under the UK Ministry of Health and Family Welfare. The register death certificate is a statistician. He's not a medical person. What he does? He looks at the international classification of diseases and he sees that the ICD is he writes, yes, ICD cause of death is this. Even this, he tries to analyze on his own because nobody is going to have time to return and discuss and see that this is not properly filled. It is not putting into any diagnosis. So nothing done. So just whatever they feel, they write and the patient. So it becomes a payment certificate to add anything to the statistics. So mechanisms of death. Never write cardiac arrest, respiratory arrest, acidosis, severe acidosis, nothing. These have got nothing to do with it. Non-specific, died of sepsis, died of hemorrhage. It could be some hemorrhage, it could be postpartum hemorrhage, it could be traumatic hemorrhage, it could be a stroke. So be specific. Heart failure. What type of heart failure? If you are writing systemic heart failure, he died of systemic heart failure. Good. Because it has been classification. And that's specific cause of death in that patient. Renal failure. What type of renal failure? So you have to be as specific as possible when you're writing the death certificate. The method, I will discuss previously, like it is also important, whether it was natural or it was unnatural. So this is the summary of the terminology. Part 1, part 2. So you have underlying antecedents and then the immediate cause of death. And then there is a part 2, means comorbidities or any other significant conditions which may have added to the death during this admission. And important thing is this time interval. So if you have the time interval, your sequence will automatically be correct. Now, errors in death certification. It's a global issue. And experience does not appear to improve the death certification. If you say that the senior most professor of the department should fill the death certificate, it will have some mistakes because he has never filled for decades. And it means the president is doing the best job because he is filling the death certificates regularly and is improving on it and is going to understand what is the correct way of filling it. So it means constant training and teaching. It is a skill how to fill a death certificate. Some factors have been recognized that why do we have errors in death certification? Like a training. Like death certification was taught to us during the MBBS days in forensic medicine, second professional. And we hardly have any knowledge regarding the importance of it. Just write it and finish it off. And when it really happens to us, we don't remember how to write a death certificate. So we are not given any formal training during internship. We are not given any formal training during the post graduations. And that is why this has been included in SGPGIMS 01 foundation course. It's extremely important. How staff is inexperienced, fatigue, time constraints, you are unfamiliar with the disease, especially you can encounter this in SGPGI, which is the tertiary reference center. Very complex cases. Dysfunctions, which needs to be prioritized, which is contributing to this illness. So we have an ethics. Complex case scenarios. And then there is not given the due importance which the death certificate should get. So he's asked to fill the death certificate. And he goes and writes death certificate, like cardiac arrest. And just whatever he feels like, something in the underlying, something in the antecedent, and ultimate cause of death is cardiac arrest. So this is what it is, and this is how we fill in our internship days. Rounds are going, some patient dies, and then you go and fill the death certificate. The junior most goes and writes whatever he feels. This is what has happened. So there has to be some training and teaching. Now, if you have a complex case and you're not sure, and it is likely that the patient will not die during your duty, it is always better to discuss with the faculty. And also the faculty should take that much of interest, and she should have that much of preventiveness. And this is a complex case, but let me discuss that the patient knows how the certificate should be filled for him. This is more important for those specialties where the mortality is high, just like in intensive care. We have mortality somewhere ranging from 40 to 45%. That means every 10 patients we lose 4 to 5 patients. So we have 12 admissions in the year, and that certificates are being put 100. And over a period of 5 years, we are giving out 1,000 death certificates. And if they are not correct, then we are adding what? Wrong data to the statistics. Wrong data. Now, errors. The errors have also been classified with major errors and minor errors. We can have minor errors, but not with the major errors. The reason is we have stressed to all the trainees. Is been done by medical. If just trying to say thinking positive residents mind, I was it should be like this. But we have a statistician, a non-medical person. So he just and boost the data. So what is mechanism or a non-specific condition is listed as underlying cause. Mechanism means cardiac arrest, respiratory arrest, severe acidosis. The sequence doesn't make any sense. They are not related to each other. They are not linked to each other. They are minor means abbreviations, time intervals is not written. We are using a mechanism. We are not etiologically specific. That also becomes a minor error. Now, this is just to give you some examples. Major errors. So, what is the major error? Cardiac arrest. It can never be the immediate cause of death. You can write it in the underline, then it becomes a minor error. But if you have this immediate, the final interpretation of the death certificate is the underlying and the antecedents and the other causes which might have contributed. So first, if this is correct, immediately goes into the data. So it has no relevance, no relevance. And then you see, nothing in the antecedent, nothing in the antecedent. And something is written, it is just confusing. Nothing is here. Now, improper sequencing, a patient with COPD for years, pneumonia, weeks, and then the cause of emphysema. Again, it might have been because of the reasons. But it cannot be emphysema. See, COPD started with COPD, landed with mental, and developed emphysema. No link amongst the three. So it is improper sequencing. It is a wrong death certificate. So we have wasted the entire energy, whatever we did for the particular patient, and what it could contribute to the statistics. Ecologically specific diseases. Now, this is again a major error. Competing causes. See, COPD and CAD. He may have the history of COPD, but it doesn't mean that it has to go as underlying cause. It was COPD which led to death, not the CAD, coronary artery disease. So, underlying coronary disease, COPD and exacerbation. So, COPD coronary artery disease have got no influence in this death certificate. The coming errors. Avoid abbreviations as far as possible. DM means it could be doctorate in medicine. I don't know, like it could be. Because a statistician is there and he doesn't know. It is like you cannot say, they keep on changing the duties. And what is D? Okay, what is HT? No, what is C? I don't know. What is C? I don't know. So abbreviations are not certificate. No abbreviations, intervals. Because this will explain nothing is written. And what I'm showing you is true death certificates from this is from our institute and from our department also. The mechanism of underlying cause of death. This is a mild error. So, coronary artery disease ultimately going to acute myocardial infarction, and then the patient has a cardiac arrest. Cardiac arrest is not correct. Certificate and it has no international classification of disease. So, we put patient for cardiac arrest in the city. The statistician cannot write anything. So, what we do is he will go down and see what is the underlying cause of death. So if you see CAD, coronary artery disease, then you might fit somewhere in the cardiac disease. And that would be correct, not wrong. At least we are in the right whole picture. So this is the minor error. Now these are some certificates. Can you tell me what are the errors? Anybody? Yeah? Major errors, minor errors. Mechanism. Full of errors, multiple errors. इसमें क्या है? No time interval. And multiple consequences. This cannot be the immediate cause of death. This is a process. This is a process. A physiological condition cannot be the cause of death. Septic shock. Septic shock. What type of septic shock? You look at the international classification of disease, there will be septic shock related to each if you're septic shock, this is correct. And you will get a proper coding for that. What is AKI? We know that this we have two certificates. Even though maybe some people who are working in primary medicine, critical care, or anesthesia, they may be knowing, but everybody doesn't know what is renal. It is not written. So this becomes invalid. See, what is it? Errors? Started with acute gastroenteritis, septic shock, altered sensorium, and then multi-organ failure. Now, is again you need to be specific. So sometimes what happens when the patients die come with sepsis, they die of obviously they will die of multi-organ failure. So they will have two organ failures. But then which organ failure contributed to death? If it was just because of septic shock, he died because of hemodynamic failure, that should get the priority over other systems. Just forget about it. Just write septic shock, hemodynamics, cardiovascular system. So you have to be very specific and precise. As far as the cultures are concerned, even if you read into the literature of writing a death certificate, they say that if you are not following the cultures at the time of and the patient dies of septic shock, you can ask the relatives to wait and then you can read that certification after a week's time. Patients may die because of some disease and you have a biopsy, and the history is awaited, and the patient dies during that period. You can tell the family that this death certification will be given to you after a week's time once you get the pathology and the final diagnosis. You have that much of liberty. No underlying cause. So again, it becomes like no utility, a lot of abbreviations. This is what. No patient's name, no doctor's name. And last year, I got a call from Delhi, and there was a patient who died that went to the court, and my resident had accident and homicide. Both were taken. Both were taken. And that case was put up in Delhi. And the judge had asked us to reach Delhi and clarify the death certificate. So you may not face the brand, but your faculties may face it because you are writing it on their behalf. So save your faculties. Verifications. Date. So some tips, never use abbreviations. ACEs when you acute coronary syndrome, and for some it may be abdominal compartment syndrome. For gastrosurgeons and gastrophysicians, abdominal compartment syndrome. So ACS. We have used comments, spell it out. It is always better to write 1st of January rather than illegible. So it is always better to spell out the month. So 1 can become 11. So this is how you can change the death certificate. See, this is the correct way. 13th of January, rather than writing 13-1/1. Or if you have to write a single figure, it is always better to write 01, 02, 05, 08. If you have to write July, it can be 07 rather than 7. Don't document. ये तो गलत लिख दिया. I need to write it. उसी को erase किया और ऐसे करके उसी में corrections कर दी. No, this is a permanent document. This is a legal document. Please take some notes and write it again and rigidly. This should not be done. Now this is where we are all in a hurry. Then we don't have this written. Just read the transplant, then something is there, and then we so hurry. We just need to fill it. Whether 100% understands or not, it doesn't matter to us. So legible. Not give anything back. So we have I have a checklist and I start from top and I finish till bottom. You will not miss any column or any row. Then you will not miss. And if you write anything, then it is always a straight line over that column. So that we change the document. It's a legal document. It's very important. It's important for you, it's important for the family. And time is important. So you have to be very fast, but meticulous in writing the death certificate. And that will come only with practice. There should be some workshops. You know, we did a workshop in our department. And then we did a study like what was happening pre-workshop and post-workshop. Because we are telling almost 50% patients are dying. You are filling the certificates right and left. And there is almost 80 to 85% improvement in writing the death certificates. So, presume these words are available to you. If you're not sure, you can write it. But then you try to be as specific as possible. If you have some diagnosis that somebody tells you from psychology that this is good, the good thing is that you can still write Klebsiella, most probably Klebsiella. So you are the key. The national data, the international data, they all depend on the information which you provide on the death certificate. You are just not signing the certificate. You are investing. You are getting resources and money allocation. It requires skill, needs some training and educational intervention. That is for sure. If you do not have any training program, you are likely to miss some important aspects of the death certificate. Thank you.